So there's now a new initiative to help businesses train staff to spot signs of stress, burnout or anxiety at work. So is this actually we're catching up with what we should have been doing a long time ago? Or, as my mum or dad might have said, come on, just pull yourself together.
Let's talk now to the Director of Mental Health First Aid, Sarah McIntosh. Good morning, Sarah. I mean, we're having a bit of fun about this, that our colleagues can stress us out at work and we might have to spend time with people in the office that we don't want to. But where does it go into more serious territory that we should be aware of?
Thanks for having me on. It's really difficult. 1 in 4 of us will experience mental ill health every year. And so from a workplace perspective, that can range from just struggling with workload or experiencing anxiety and stress. Mental health first aiders are trained to spot the signs of someone who may be struggling with their mental health. And they're designed to open up a conversation with them about their mental health and well-being so they can understand what's happening to that person and signpost them appropriately to support and, where necessary, GPs, professional support, mental health support as well. And what we do know is the earlier that people have conversations around their mental health, the more successful their recovery will be, the quicker their recovery will be, and the more likely that their longer-term mental health outcomes are going to be positive as well.
Where do you get the figure 1 in 4 from, Sarah?
It's actually from the charity Mind and their research, so it's quite extensive research from our colleagues over in the Mind charity.
And so when you say, the interventions early are going to have a better outcome, that makes complete sense. But what a difficult conversation to have with somebody at work. Like, how do you broach that? Because some people could get quite prickly if you say, you just seem a bit down or you don't seem like yourself. Like, what would your advice be in terms of that initial contact?
Well, most people would welcome a conversation. I think if there are people who are more closed off or not wanting to open up a conversation, mental health first aiders are trained to sort of be supportive of that and respect that, but to continue to keep an eye on them and make sure that they're okay, and perhaps, signposting to their line manager or their HR teams to have a conversation with them if they continue to be worried.
Sorry, Karen. Go on.
I was just going to say, so you'd like what sort of level of training to be offered for people in the workplace, and who would do that training?
So we'd love there to be mental health first aiders in every workplace, but only as part of wider workplace legislation where employers really have to think about their overall holistic approach to mental health and well-being and the wider support that they can offer people when they're struggling as well. So we offer training to lots of people who want to become mental health first aiders. We work with over 20,000 workplaces who've trained with us and put mental health first aider networks in place. It's a 2-day course. They're trained on a range of things, from understanding what good mental health looks like, why some people have a higher prevalence of mental ill health, some of the mental health conditions and the signs that you may notice in someone if they are struggling around some of those conditions as well, and how to open up a safe and structured conversation that's very centred around the person and the support that they need to get them signposted to either help themselves or to signpost them to relevant professional services.
Isn't part of the problem as well, Sarah, that by its very definition, a lot of people are going to bottle up whatever it is that's causing the anxiety and the stress and the strains, and therefore how do your first aid practitioners unbottle it?
It can be really hard for some people who have got, bottled up concerns. I think there's a couple of things that workplaces and society generally can do. Is we need to remove the stigma around talking about mental health, and that contributes to people perhaps not wanting to be as open about their mental health with people. The good thing about our mental health first aiders is once they leave the workplace, they go home and they can talk to their friends, their family members, their people in their local community, and people that they might know a bit better and a little bit closer relationships with, and they can really open up powerful conversations that are life-changing and life-saving for those connections at home as well as in the workplace.
People might be concerned, of course, about their jobs, Sarah, and thinking, if I tell somebody at work that I'm not feeling great, when the next, round of people cuts come, maybe I'm going to be on the list.
Yeah, mental health first aiders are trained to be completely confidential, so discussions are confidential unless there's a risk of harm to